20th, 2019 meeting of the Tilton Budget Committee, and we're going to begin this meeting with a pledge of allegiance. Please join me. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, and Jane?
Yes.
Hi.
Hi, how are you?
Would you like to come up and talk to us
Can I
about
get a little closer?
the sign-in sheet?
She already did?
Oh, she already signed it.
She got me going.
She's good, she's good.
All right.
Jane, we'll go around the room and introduce
Oh, yeah,
ourselves.
the microphone over there.
If you'd like to sit there, so you can talk.
Yeah.
Peter Romero.
Christine Zimbritsky.
Jane Alden.
Catherine Wilson.
Bill Lawrence.
Welcome, Jane.
Thank you.
And I think we have your paperwork. If you'd like to give us a little bit of information about what's been going on with Future in Sight, what you're asking for, and what you've done in terms of servicing the council.
Sure thing. As you know, Future in Sight was formerly known as New Hampshire Association for the Blind. And in 2016, 2017, we changed our name to Future in Sight at the recommendation of a lot of our constituents, mostly the physicians who refer people who are experiencing vision loss. Part of it was they thought we would get to see people sooner if it wasn't so scary after getting a diagnosis to be referred to a place that was called the Association for the Blind, because people might think that, I think the expression was, I'm not bad enough. I don't, it's not that bad. Other people need help more than I do. So our numbers have increased significantly. I joined the organization in April, so I don't have a long-standing history, but I have certainly seen a lot as I've been putting things together. We serve people of all ages, but primarily the people we serve are 65 or older. It tends to be demographically a larger base, but we see infants and toddlers and kids in school. But in Tilton, in the last fiscal year, our years run September 1st to August 31st. So when I submitted this work, all the numbers hadn't been in for the fiscal year. But we serve 6 individual Tilton residents in our fiscal year 19, and more impact through group work. We have currently, the number is 2, but it seems identifiable, but we have 2 folks who continue services and participate in our groups in Concord. We have a technology access group, and we have a peer support group. And so we have volunteer drivers who transport people to those kinds of groups. So in the past year, you have been a generous and important part of our funding pie with the $2,000 contributing to our base. 40% of our budget comes from fundraising, individuals, foundations, endowment draw, if you will, from people who left us bequests over the course of the year since 1912. They're put away so that we can expend the interest.
Any questions?
I'm sure there will be.
One of my questions is, you say that you had 10 people active in the support groups or the various groups.
Yeah.
Are they all are from the Tilton area?
The town of Tilton
The town
itself.
of Tilton.
So the numbers that I found, I pulled.
Okay.
We have a really good database. I don't want to do a Salesforce ad, but they use a database called Salesforce that has
Okay.
all that in there. We track by town.
And you, are you providing any new services this year from what you did? I know in the past we had requested that you try to do more with young people, and I know that you came back and said that you were working with the schools and that.
So we
Have
are.
you expanded any of those services, or have you added any services?
So I would say that from the expansion, I'm not sure from what point of what you knew, but we call them youth and adult explorer groups because give people a chance to enjoy what is outside, and it could be even inside in an art setting, so that you can experience things that are enriching. And so in fall and spring, so twice a year, there are four activities for adults and four for youth. So we have been doing that and adding that. We got some funding from the Samuel Hunt Foundation to help specifically fund that. And it's, the youth ones particularly are good, not just for the kids themselves, but for their siblings and their parents. Sometimes there are things that they can then do with the family because they've experienced it that way. We serve about 160 kids throughout the state, not specifically in Tilton.
No.
The work that we do is itinerant, so people don't come to us, we go to them. Each person, when they're referred, comes through the social work department and has a chat and sees what's getting in their way, from things as simple, which might sound simple, but people are struggling in their kitchen with seeing things that they're used to. So there are tactile, we call them bump dots, that you can put on the stove and microwave so you can find where things are. Even doing some rearranging. So whether it's a low vision specialist, someone who's called an orientation and mobility to help people navigate their way around the house and out in the yard. It can move into using the white cane, but it can be just removing trips and fall hazards that prevent kind of a decline from there. So.
I have a few, I'm sorry.
No, it's fine.
One of them is, you served the 4 Tilton residents. How did you serve them? Was it in-home? Was it over the phone?
So nothing is only over the phone.
Nothing?
So it's always, so
They either came to you or you went to them then?
yeah, most.
Okay.
So the number is actually 6 because I wrote 4, but the number is
Oh, good.
6
I like that.
because that was an earlier in August number. So because our year ended August 31st.
Okay, that answers that. On this balance sheet, it's as of 5/31/19. Your year end is 8/31/19?
Yeah, so at that time, so the quarterly, that's how often
Okay.
we do that.
And then on this, numbers, I like that we have all the towns. But it doesn't say what the town contributes, or
So,
what you've asked for.
so Tilton is the only town that I have asked for our money from at this point.
Okay.
Because I started in April. You supported us last year, so I have on my tickler to make sure to do
Yeah.
what I need to do. We're a small department, and so what I'm looking to do is to identify the towns that, like a top 10, but you're it.
Okay, so.
You don't ask for any other towns?
So I haven't. I plan to, but I just got,
Oh, okay, but in the past?
in the past,
Yes.
Meredith has,
Yeah.
and,
So in the past,
Like
where that has, did the prior person ask other people, other towns, or no?
not that I can tell, but I'm digging through files.
I think last
Okay.
year they asked like 3 towns.
That's
But
all,
I
that's
see
what I
that
can
you
find.
haven't even got the money that we give you. You haven't, still in our budget.
I don't know.
Oh, is
Well,
it
it's
not
just
dispersed?
in-
No, it has not been picked up.
Yeah, it's still in our, I was just looking to see who has claimed their money and you haven't.
And this is not the first time, and I know you're new, but I think that may be the reason, because every year it seems that we have a new person. Shelley was there for a long time, and then when Shelley left, it seems that the turnover's been fairly great.
I've noticed that.
But the way it works is that you have to come, you make a presentation to us, and then at some point we vote on whether we're going to grant you the money or not, and then you have to pick it up. You have to call us. If we don't call you and say, gee, we gave you so much money, you need to call us to see if we gave it to you. And then you have to come and pick it up. And so I think you will find that there's, I think it was 1,500,
500.
500 last year that you need to pick up.
I'll do that. So if we haven't picked it up, it seems that maybe we should
You should pick it up, okay?
pick it up.
Because what it looks like to us when you don't do that.
You don't need
is
it.
you
Yeah, we
must
don't
not
need it.
care.
Yeah.
So that's not true, no. As we keep serving more people and try to serve more people, because the need is bigger.
So you have over $9 million in assets, is that what I'm reading?
Yeah, so we have an endowment from folks, you know, who've been around since 1912. And our policy has always been, when we get a bequest that we don't expect, not to put it in operating and have it disappear. So it's set aside so we can use the revenue from that. So it helps us.
It's a lot of
Well, it
revenue.
looks like you're gonna need to because you got lower revenue
Yes, we do.
than you budgeted.
Yep. Yeah.
Sorry, Patty.
Okay, well, thank you.
Thank
I
you
have
very
one
much.
more question.
Sure.
Is this variance percentage based on actual budget or prior budget to current budget? I don't know what this variance is for.
I don't know.
I don't know if you prepared these or something.
No, so I found this person.
I
So
mean, I can
we're-
calculate it and figure it
No,
out
we're-
later, but
Where are you?
the statement of revenue and expenses. If you don't know.
So the
figure it out
variance is to
later.
budget?
Budget to budget,
Yeah.
so not actual.
Well, there's year-to-date actual, and then there's.
Right, that's why I didn't know if that
Yeah.
the variance was from what their difference was or from budget to budget. It makes a big difference.
Well, I look at that and I think that it's to actual. Fast math.
Well, 498 variance that's in red, maybe the difference from actual to budget, 410, yeah,
Yeah.
that's probably it.
Yeah, I would say that,
So-
but I'd have to figure it out.
I like that
too.
better.
But I appreciate that you have a lot of requests and you need to come pick that up. So I'll stop downstairs and find out how to do that, and I appreciate your time very much.
All right, thank you.
Thank you.
Thank you for coming.
Sincerely, I have brochures, I'm not sure where to leave them, but
If you leave
Social
social
service
service, I'll
officer.
make sure that they
We'll
get.
leave them downstairs.
well, people have them.
Okay, thank you so much.
Thank you for your time, appreciate it.
Jane?
I'll wait, because I want to bring up another rule.
You received it, this is in here.
Okay, so,
Thank you.
This is in one of our folders.
Marta, sit
Yeah, right.
Yeah. Actually, now that you said that, I'm gonna. Right.
In our,
Good night. Good night,
Good
Jane.
night.
thanks.
Thanks, Liz.
we have the American Red Cross. And the woman who represents them is located in Vermont. and I believe that she has asked that we call her on the phone and get her presentation then. Is that not correct?
She did request it, yes, but
Yes.
she's also working with some of her coworkers in Concord to see if anyone is available. I'm gonna call her again. I've
Okay,
talked
because
to
we need to wrap this up.
Yes.
And I have my own personal opinions, but I'd like to hear how the others feel about doing anything over the phone.
Those allowed.
I mean, it's new technology.
It's allowed.
Yeah.
If
But
it's allowed.
then you gotta use somebody's cell phone. That's what I
Um,
think.
we often, the selectmen take one of the, there should be a desk phone over there with a really long cord and put her on speakerphone.
Okay.
The 91A, they have to hear us and we have to
And
hear
we have
them.
to
Right,
let
right.
her know.
And our audience needs to be able to hear.
Yeah,
Or we take one of these and put it.
But, there should be a desk phone up there.
Yeah, I
Because
guess
that's what we used to use.
that. I mean,
Really
maybe
long
they'll
cord.
have more people near her that can answer questions.
so if she could do that the week after Thanksgiving,
Well, she has locals, but they're not gonna-
December 4th.
yeah,
Okay. I'll give her a call tomorrow.
okay?
Can we ask her to provide us with what the other communities in Belknap County contribute?
Yes.
Thank you.
I'd like to make a suggestion for the future application again, I know, because I will forget later. Does it say on here that they should be someone here that needs to be able to answer questions or anything? It doesn't say anything, does it? You
No.
call them and have them come in. Okay. So maybe we could put something in there, somebody who presents to us needs to be able to answer both program
I think
and
we could
financial.
put a phone number on here for,
Yeah.
we could call them ahead of time.
Can we do that individually, or
What was that?
can we do that individually, or do it as a board?
You can call up individually and ask anybody for information and then share it with the rest of the members.
Okay.
Or that we can ask them that what we've done here, for instance, we have, in the information that we got tonight, we have the information requested from CASA. They sent it to, from CASA, they sent us the information, and also from visiting nurses. So I think for the most part, we've never asked anybody to provide something that they haven't been willing to do. I think one of the problems in asking for the financial person to be here is you're talking very small organizations for the most part. The Red Cross may be an exception, but I think, and sometimes it's hard to get,
But even
Two
still,
people
they
from
should
the
have prepared, they
organization.
should have prepared her, even if they didn't come, the accountant should have met with her, because I can't even ask her anything about what's going on, because she's, poor girl just started in April, but
yeah,
when they send someone to represent them, any of these companies, they should be, you know, have a meeting with them and preempt them to, you know, what these mean.
I think
Because it's hard to look, I feel bad.
what you want is at the end here, it says, please submit any additional notes or documents which will help explain your. What we should have there, say, if you are a multi-town,
Right, we did that
Yeah,
last
we
week,
did.
yeah.
That was on
Multi-town
here?
provide that,
Yeah.
yes.
please include your percentage of what they give and how much service. So that was on there?
no, it was not, but we requested that next year we put.
Oh,
that.
yeah.
Yeah, when we got, yeah, because I can't remember till then, and that's why every meeting now, I'm trying to put in the minute notes, and then,
Right.
I mean, luckily the lady knew about the, you know, the $1 million endowment that Catherine asked about,
Yeah.
but they put the endowment, you know, like a $7 million in investment. I don't know, it just,
I find it interesting, they only asked Tilton for money.
Right.
Yeah, she
Well,
said
that happened
because they asked-
That happened last year too, and we
Yeah, because
we were saying, well, why would we
asked 3 times
we should give them money, no one else does.
last year, I think the lady,
Yeah,
And we were giving
I
them, like,
understand why they keep that, all that money there, but $9 million, over $9 million in assets?
yeah,
Well,
and she only
you
asked
think
us, she
they're-
said, because she saw that we gave last year,
Yeah,
so she doesn't know.
Right.
and it's like I said, I
They got a
know the
lot of
last,
money.
they had one, and I'll give you another example. We had somebody who was there for a long time, and she knew the answers to everything. She's now in another organization that 2 years ago came for the first time and asked for money. Because we had given to Future and Life. I'm not saying that's why, but I don't think that was coincidental. She knew that we would give money to organizations.
Well, they always ask us for 2,000, but they only ask Meredith for 1,000 and Delma for 500. And when that came up, they said, well,
Yeah.
we asked, have they given you money? And they said, no.
They have people that service.
Yeah.
Right. So we gave $500 more than anybody else.
172 people.
And I'm willing to bet a lot of these reds is because they have so much staff change. I mean, there's so much money they're not getting.
Sorry.
You can do that, Ted.
To go to Manchester?
Yeah.
I'm not sure they service there.
They do, there's a
There's
ton.
100 and
Oh my God,
Well,
they
I-
service, it looks like the whole
people.
state.
That was surprising to me, that to look at some of the, like Boscawen.
Yeah, I know,
How
I
many
was.
people they service in Boscawen?
Manchester,
15.
172.
Well, the population.
Right.
But look at
Bridgewater.
Boscawen.
Yeah,
Just
15.
And then
Exeter,
and
25.
Pembroke was 19, I
Uptown.
think.
Exeter 25, you know, there's like Concord 74.
Yeah.
Yeah.
Laconia, 31. They're right up the road, right there.
Right.
So
Franklin 11.
that will be considered in voting.
Okay,
You want to do minutes or something?
we've got 5 more minutes, so why don't we look, we've got 2 sets of minutes that we need to review. So why don't we look at October 9th minutes? We just got these tonight, so we can at least read through them, the 9th while we're waiting. right, has everybody had an opportunity to read them?
I move we accept the minutes of October 9th, 2019.
I'll second.
All right, any discussion?
Do you have a microphone? James, your microphone?
Did you need us to repeat it?
No, I just hope they can hear me.
Can you hear us now? Or do I need to turn this
You
around?
need to turn it,
You
you
need to
just
have it
flip that.
towards you.
And I just can't read it. Thank you. All right, the motion has been made and seconded. There's no discussion. All in favor?
Aye.
Opposed?
Abstain.
One abstention. Okay, so we have those now. Hi.
Hi, from New Beginnings.
Hi. Come on up. You're Kathy?
Shauna.
Oh, okay. Is Kathy gonna be joining?
She's not. No, I'm the program manager though.
Okay. And you're the program manager, Sean?
Yes.
This is New Beginnings.
And we need, you have the log for her to sign.
Mm-hmm.
Sign it, Sandy, sign it.
No, I don't think so. I've been on maternity leave, so I don't have a copy of our application. I don't know if you want me to refer to that. I would just need a copy. That would be great. Thank you.
I see you brought the new baby with you.
Yes, Matilda.
For that. Okay, I think we have a lot of paperwork here.
Yes.
Why don't you tell us a little bit about what the beginning has been doing this year?
So as you know, we're your local domestic and sexual violence crisis center. Thank you. Thank you very much. This last year, our numbers increased by about 100 individuals served. So we're up to 846 total for this most recent fiscal year. That's up from about 737 the year before. We finally, I come here every year telling you that we are trying to get a satellite office in Tilton. Our board has approved one and we have it as a budgeted line item. So one of our board members, who's also a Tilton police officer, has been helping me look for properties downtown here. So we're looking for something that's walking distance, that folks can come to as a drop-in center, and I think that that will greatly increase our number of Tilton residents served. So we're very, very excited about that. We have also, and I come back in January, so you can expect that that will be up and running, I hope, by the spring. It'll be a couple days a week. We did also secure funding for transitional housing, and we're taking a different approach to that than a brick and mortar facility. We were awarded $300,000 from the Office on Violence Against Women to offer housing first style transitional housing. So what that means is that if a Tilton resident who's also a victim of domestic or sexual violence is suffering from housing insecurity, she can't afford her rent, she's been couch surfing, maybe she's been staying in our shelter in Laconia and wants to come back to her community in Tilton, we can pay for her first month's rent, security deposit. There's about $500 per individual for emergency funding and subsidize a portion of her rent for 2 years. So during that 2-year period, she's going to be meeting with advocates. We will provide in-home services for her. And we're also partnering with Navigating Recovery for victims who are also experiencing substance use disorder to help them maintain their sobriety. So very, very heavy hands-on assistance while we're paying her rent. As she becomes more independent, we'll scale down the dollar amount each month until eventually at the end of the 2-year period, she's self-sustaining and she can continue to pay that rent on her own. So we're hoping that it will really foster some independence in those that we work with and reduce our average length of shelter stay, which is still quite high. It's about a year is the average for both families and individuals that we serve. We're still doing prevention education in all of the schools. New this last school year, we're actually in every single school in the Winnisquam Regional School District. So we are in both elementary schools, in the middle school, and in the high school. And that's delivering age-appropriate, evidence-based prevention education. So for the younger kiddos, it starts with identifying safe individuals to talk to, identifying body parts, learning about safe touch, hands are not for hitting, anti-bullying programming, things like that. As we get up through middle school and high school, they're learning about what does consent mean, what does a healthy relationship look like, what's an unhealthy relationship, what are the resources that are available to you when you're not experiencing a safe relationship. For outgoing seniors, we do a lot of prep for college. What are your rights as a college student? Looking at Title IX and things like that so that they can get any protections that they need when they leave home and go on to college. And that is it. We did also secure funding for a new position, focusing especially on children who've been exposed to violence. We haven't hired or even developed an idea of what that will look like, but the funding is there, so later this year we should be hiring a new advocate as well.
We found with the opioid crisis that the need has increased.
Yes. What we found, the incidents of domestic or sexual violence have not increased, but the needs of those experiencing it have. So the housing insecurity went way down, the homeless population went way, way up. Our average length of shelter stay skyrocketed, and we as a staff have really needed to educate ourselves in terms of folks using in shelter. And what does that look like? How do we identify it? How do we provide a safe space for those folks? We do not exclude people who are using substances from our programming or from our shelter. We feel that it's often a way that victims cope. We don't want to punish anyone from suffering from a disease. So our rules are that they not use in the facility. So if they are choosing to use, we just ask that they call us, that they are safe, and that they come back to shelter when they've regained their sobriety, and we hook them up with local resources.
What's your service area?
All of Belknap County. We do occasionally get people who are relocating from out of state or really nationwide. We don't see that quite as much, but we really focus on Belknap. So we're one of 13-member programs of the statewide coalition.
And your funding is from Belknap mostly, or?
We don't receive any county funds. We're largely federal dollars, some state money, a little bit from the towns, as you know, and then we get private funding as well.
You associate all the towns in Belknap County?
Unfortunately, not all. Barnstead typically chooses not to offer funding, and historically Stamberton has not funded us. I know we've talked about that here before. It's frustrating for us, as I'm sure it is for you. We do ask them every year. We do not, we'll still provide services even to the towns that don't choose to provide the funding.
Could you provide us a list of the communities in Belknap County that do provide you funding, and how much and how many people you served in those communities?
Yes, so I can give you the list now, and I could get you the spreadsheet tomorrow if there's someone that I can email. I can give you the exact numbers.
Marina.
Perfect.
Yeah.
See Marina afterwards and she can give you her number.
So do we have a budget committee email?
Huh?
Oh,
Oh, yeah, there is.
Yeah, she
Yes,
does.
it spreads it out.
So we dump it on the secretary.
Yes.
How many men do you serve?
That's a very good question.
Or how many men did you serve in Tilton? Let's put it that way. It says you served 29 individuals.
I would guess just a handful of men. I can get you that exact number as well.
Okay.
93 or 94% of our total numbers served are women. So much fewer men. There's still a big stigma with men not feeling safe coming forward, victims of violence, but all of our services are open to them, including this new transitional housing program. So if a male survivor said, I have nowhere to go and I'm lacking resources and I need some support, that program would be open to them just like it would for any female survivor.
And what services would your drop-in center provide?
All of the same services that we
Or
provide.
should I say, what would be the purpose? You said you'd only be open a couple days a week.
So the purpose would just be to get closer to you guys. Belknap County is very rural. We know a lot of folks are on foot. So we know that service number in Tilton is very low for the community that we're living in. We live here in Tilton. I know that the need is greater than what we're seeing. So our hope is that by bringing the services to the community, we'll see the people that we know need the assistance.
And what type of agencies refer to you?
We partner very heavily with law enforcement agencies countywide. Both Franklin and Laconia courts call us anytime someone's filing a restraining order or expresses the need for an advocate. We partner heavily with Lakes Region Mental Health, the Family Resource Center, both in Tilton and in Laconia. The Child Advocacy Center is a strong partner of ours. We go to every forensic interview that they conduct to support the non-offending caregiver. Lakes Region General Hospital. We don't respond to Franklin Hospital as much. Our sister agency in Concord covers that, but for anyone that we're already working with, if they're going to the hospital and call us, we will respond to Franklin Hospital as well. Who else? I'm a little rusty. I've been out for 6 weeks. That's really the main, probably the main hub. Lakes Region Partnership for Public Health, and all of the schools we're on call to.
Thanks, thank you.
So for this drop-in center in Tilton, to get back to your original question, what we would be providing is hopefully a weekly support group. That would take time to build up, so I don't expect that would be going right away. One-to-one peer support. So Laconia, we're a drop-in center. People ring the doorbell and say, hey, this is what's going on. I'm not safe, or my relationship doesn't feel right, and maybe it's not bad enough that I want to leave, but what does this sound like to you? So we'll help them figure out what the dynamics are, figure out what their next steps could be, really talk about any trauma that they've experienced in their lives. A lot of crisis management, so sometimes they are coming to us and they're in danger in that moment. So in those cases, we're helping them to identify resources, come into our shelter if that's what they're hoping to do, relocate if they need to actually get out of the area to gain safety. It's often going to court, so if we're right here in town, we can get to court very quickly if someone in Tilton needs to head over to Franklin Court to file a restraining order. Really just being present, the visibility goes a really long way for getting people the services that they need.
What is their alternative if they go to the drop-in center and it's closed and they need some immediate assistance?
We have a 24-hour crisis line, so our advocates are available 24/7, 365. That often includes phone support, but it also means going to the hospital with people overnight at any time of day if they need support at the hospital, going to court during court hours. So we haven't figured out what that will look like at the space. Is there a sign on the door? Is there are we going to partner with the police department to make sure they're getting us a referral? I'm not quite sure, but it would not be someone showing up and the door is locked, so oh well, they wait till next week. We would make sure that they could get connected immediately. So even if it's a day that the drop-in center is closed, an advocate would come right down. Right now we're meeting folks at Dunkin' Donuts and Starbucks, and it's just not ideal. Yeah.
Thank you.
Sure.
How many volunteers do you have?
Not as many as we need, so if you ever know anyone.
Good plug.
We always need crisis line volunteers. Right now we have 7 or 8 really dedicated individuals that help to make sure our services are available 24 hours a day. When our volunteers are short, our staff step in. So I'm still taking crisis line shifts. Our hourly advocates are taking crisis line shifts. So it's not just a 9 to 5. Everyone's very dedicated to our mission and make sure we keep going.
Okay, so on the balance sheet, you said you were gonna have a place in Tilton. The buildings, improvements has gone up significantly to 83 under your assets, so I didn't know that you have a lot of problems with the building you have.
We did, yes. We secured our current site in 2000, and we had to take the lowest bids on everything because of the, we got a special mortgage program through the New Hampshire Housing Finance Authority, which is fantastic. We're very pleased with the arrangement, but it's meant that after 20 years and 500 plus shelter guests in that time period, and think of the populations that we're seeing in shelter, there's a lot of damage done to this space, unfortunately. So our most recent improvements have been tiling 2 of the bathrooms that had some water damage on the floors. We put in new ventilation systems in the shelter bathrooms. We had some problems with folks not turning the fan on when they were showering, so that created problems over time. And we replaced all of the shelter bedroom floors with bamboo wood floors.
So what do you expect for this budget year?
For
For
necessary
that
repairs?
very old building, yes. Because that's more than double.
Yes, it is. There's nothing that we are currently, ready to move forward with. The kitchen is the next big thing that we're hoping to tackle. The cabinets are starting to fall off the hinges, so we need to do something about the kitchen. That's it for major stuff inside. Our parking lot is in disrepair, so we're trying to get someone to fund repaving the parking lot. It's full of potholes and there are no parking spaces anymore, so the handicap space isn't really reserved the way it's supposed to be, things like that.
Right.
So we imagine major repairs like that coming up over the next couple of years, but we're not in bad shape. Nothing is emergent.
Okay. I see your income's up, by the way, from prior year, but so aren't your expenses.
Yes.
I didn't have, just one stuck out of the ordinary. I didn't have a chance to really go through all of them, but emergency assistant expense. So you're finding that you're having to do a lot more of that?
We're finding that we're able to do more of that. So with the funding going up, we're using that where it's the most needed. So the restricted grants won't pay for things like a bus ticket to Florida or a child's medication and not taking the meds with them, or subsidizing rent before we got this new big pot of money. Snow tires so mom can get to work so she can keep paying her rent. So now that our funding has gone up a little bit and those unrestricted dollars are there, we're putting it right back in.
Do you have a waiting list?
We don't do a waiting list. We do first come, first serve.
So when it's full, then you have to refer them somewhere else?
Yeah, we refer them, but we don't just say, call this number. We make sure they get somewhere. So if someone is in Belknap County, needs shelter, and either wouldn't be safe at our shelter, because a lot of people know where we're located, we're an open site, or if we're full, we physically get them somewhere else. So we're making calls to our sister agencies across the state, and if everything works out and the person is relocating there, we'll meet the sister agency halfway on a 24-hour basis. If it's the middle of the night and we haven't found an opening, we'll put them up in a hotel and we will drive them to the hotel ourselves. If they're going out of state, we're doing bus, plane, train tickets, all of that. So we're making sure that folks have somewhere safe to go.
Are you full often? Or?
Yeah. Last year, our longest vacancy was just over 48 hours. So as soon as we have a bed, we're getting them
How
home.
many people involved?
15 roughly. It's sometimes we're full and it's fewer. And our family rooms can sleep 4. But if it's a mother and 2 kids, that's only 3, so it really varies. We always give families their own individual space. We are never ever bunking families together. We have 2 single rooms, and we try to give women their own space and let them stay there individually, but we reserve the right to double up in emergencies or for temporary situations.
And the new one that you're looking for in Tilton is just a drop-in service, not a stayover.
Correct. Yeah, so that would not be a shelter. We're shelters across the country are getting away from brick and mortar for exactly the reason that you pointed out, that we're having all these very expensive repairs. So that's why we're going more toward this housing first model. It's better for families too, because they're not constantly shuffling from program to program. They're getting somewhere and we're helping them stay there.
Would a church be a good drop-in?
Sure.
There's a Trinity, which is pretty much empty. I'm not sure what the congregation does, but the 2, places downtown that might be a drop-in center.
Yeah, that's a great idea. I'll look at that. We partner with Michelle from the Congregational Church quite a bit. So
Okay.
I'll see.
Yeah,
I'll see if there's a space. Yeah.
Yeah.
Every once in a while, there's a barrier if someone, doesn't mesh well with religion, but we don't see that quite as much. So I think that would be fine.
Yeah, I mean, the Trinity is basically dormitories now,
Okay.
and they are pushing people through different processes that are in ministry. I don't think they have anybody over there right now. And they have that whole upstairs, which is not used.
Oh, that's perfect.
Yeah, so.
Thank you.
Yeah, sure.
I'll look into that.
And
I believe that the diocese in Manchester, those are the people that you
Oh,
contact.
Concord?
Concord,
Concord.
In Concord, okay.
they're in Concord, very nice people.
Yeah.
Extremely nice. All right, any other questions? Thank you.
Well, thank you.
Okay, thanks.
I have something on the October 9th minute meetings, we'll have to get back to that now, after she's done. Cause, I know, but I got 2 pages of the same.
Oh.
Yes.
Thank you. Is it only 2 pages or is it 3? This is 1 of 3 and I got 2 twos.
Yeah, there's 3.
Oh, that's
But
16.
what does your last page
Three.
say, 2 of 3? Oh, I did that one, okay.
3 of 3, yeah.
Yeah. Get it?
Mine,
Good job.
Thank you.
Thanks, have a good night.
Good night.
Thank you.
See you later. Another reason I asked is I just kind of wanted to know if the approval was already voted on, because I saw that one was voted on here. Is that the only one? So, okay, thank you.
All right, the next one was, they've, she had all the answers.
Yeah,
She had all the answers.
Yeah, it's good. Yeah.
she's getting us,
Well, she, for the towns, but she had the answers on the financial things.
And I asked her how much money each town paid.
That's it, she.
That's
said she would get-
finances.
Well, not really, it's not the financial sheet.
she seems to be very involved, so she would know
Yeah.
why, that she probably don't know the figures, but she would
Yeah,
know
she's the
why.
program director.
Yeah,
Yeah.
she was here last year, right?
No, I think.
Yeah, I
I
remember.
thought Kathy was here last year.
No, I think it's her, I remember her. Kathy was probably here before. Okay, so we're on the next meeting.
October 16th then.
We actually didn't have a quorum of that meeting.
Yeah.
What, this meeting?
Right, so it's more of an informational than anything.
Okay.
You can't, we couldn't vote on anything.
Yeah. That was, I was in North Carolina.
Right.
I was taxing it.
Good job.
Yeah, why did I miss that? 16? Oh, I probably was up past midnight.
You were out of state. Were you out of state for one of those meetings?
Oh, yes, I was out of state when Jane was out, because after tax season, I go to Florida for a few days. Because October 15th.
Well, there were only 3 of you.
Yeah.
All right, so we really can't do anything with these. These are just
Information.
for information.
So since we can allow a outside vendor to call in, is there regulations regarding a board member if we needed a quorum to be via phone, Kevin?
Say that again?
You know, we can let Red Cross do the phone thing because they're allowed. How about a board member, like if we didn't have a quorum?
You could do that.
So we need to keep that in mind.
Yeah.
Yes.
Yeah, I actually
Okay.
went to my rules of order after
Okay.
that because we
Like
were,
when I,
and it says, yeah, you can actually, yeah,
Okay.
bring in a member by via phone or something, yeah.
yes, there's some criteria
Or you can
there.
run around and go to their house and drag them down here.
Okay.
So we got CASA and
We got all the
DNA.
information, they sent us the information, so we have that now. So I think that we're not meeting next week because it's the day before
Thanksgiving,
Thanksgiving.
okay.
We are the next week, so be prepared to go over the,
Maybe do some voting.
do some voting and go over all the presentations that we've had, and we can do some voting. And then go over the financials that Tim just provided us. We haven't had those for a while.
Do you have a budget?
And we do not have a budget yet,
No.
Why don't we have a budget?
because Tim hasn't given, he didn't have it ready when I asked him last.
Well, he gives it to selectmen. I asked him that when we walked out, I'm like, why don't we have it even?
What did,
Huh?
what did he say?
He said it wasn't ready, but he
That's what
has
he
one.
said to me. He
But
told
He
me-
has one to give to the
He
select.
told me it wasn't ready too.
Yeah.
So the board budget committee doesn't just rubber stamp
No, we do
the
not.
selectmen, so they she
Right.
should have provided you with really the same draft budget that the selectmen got, and made the budget committee aware of any changes that take place to the process, because you haven't interviewed any of the department heads yet, have you?
No, she's making arrangements for that, just to get them to come in.
Maybe
But Tim told me that it wasn't ready, and he told you that it wasn't ready.
Because he wants to hand you the selectmen's approved budget.
No, no,
Yeah,
no,
no.
no, he knows better than that.
Okay, but
let's
that
ask
was
him.
the only thing I can come up with, because we've
I
had a
didn't know
budget,
that you had it yet.
we've had a
They've
budget
been working
since
on it.
October,
Yeah.
that we've been working on, making
So
changes
email
to.
Tim, send us a
We were
copy
in a
of the
week.
draft.
Yeah.
Just because when they come in,
Want me to
it's
talk
better.
to him?
No, I'll talk to him, I don't know why he told two of us that.
Well, I just, it's, this is the budget committee.
Yeah,
You should have had a budget the minute there was one out there.
Yeah. I thought that's why he was keeping us updated with the expenses, so that
well, this is the first financial we've gotten.
For a long time.
He told us he didn't have it. As a matter of fact, he came up here last time and said he didn't have it.
I went down there on my way out. But maybe he's saying he doesn't have final. We will
I
keep
think that's
the
what
draft.
that's gotta be what he means. Is
Are
he
all the
doesn't have-
minutes on the site or videos are on the site up to date for budget?
the minutes should be ready.
Yeah, they should be.
Okay, I'm just asking because I want to,
Oh,
before
the
voting,
minutes.
I want to be caught up
All
on.
of these should be on there.
Okay, what about
Where are the
these
videos?
videos of our meetings?
They
Oh,
should,
okay,
they're on there
I think
immediately.
they're pretty much up to date.
Yeah, I don't really understand
Last week's might not be.
okay.
these figures that we just received.
From which one?
From which one?
Well, both of them. But CASA, it's got, so this is what they're giving, right? That's what they donate. What's the percentage?
The percentage of CASA's Belknap County budget in terms of children served and donations given, I don't know. I'm sorry, I don't.
I don't understand what you're saying. Are there 58% of what?
So is the I don't know.
The city gives $1,000, and what does 58% mean?
Don't be fine.
Well, it says, please state the percent of CASA's Belknap County budget. So Laconia must take up 50% of that budget,
I understand, yeah,
but
that.
it is unclear.
I suspect it's the
All these
cost,
other people, that can't be 58%.
it's probably the cost of the services they provide Laconia.
From the budget, yeah.
Well, what do
You
we
You know
ask
what
for?
I mean? Because they'll show you a cost.
So Laconia takes 58% of their budget, is that what you're saying?
I'm guessing that
That's what it says to me.
the value of the services they provide, I'm guessing
And
that's
they
what
take
they
9% of their budget.
I have
It
one.
costs them, takes 9% of their budget to provide the services to Tilton. I was looking, did they tell us how many? They didn't.
So, yeah, they already gave us the dollar figures, because I have that written down, and we asked for
So
what
they
percent.
didn't give us the
Okay,
number
yeah, so that's the
of,
total percentage of their budget, because I just counted it up, and it comes to
Yeah.
100%. So Laconia is 58% of their budget, we're 9% of the budget.
And
Okay.
Laconia gives 1,000.
but they didn't break down the 104 children served in Belknap County to communities.
Right.
Right. Yeah, so. Yeah,
But I
and
guess
it's
the-
funny, we give the same amount as Laconia, and we get
9?
1.6%.
There was a lot, I think last year we
Although
talked
Center
about
Harbor gives
percentages
$1,000, and they get
counting.
1% value.
Remember that? All the groups.
So I guess they don't use the same, they don't use the formula. This is just,
Right.
these are just dark
Yeah, yeah.
figures.
Well, it looks like DNA has a detailed
There
one,
are 11 communities in Belknap County? No, I'm not gonna
have all the cases would take the same amount of time either.
Right, or that, yeah.
Yeah, so, you know, you got.
And that's why I think Catherine said about the 104 kids, so
Yeah.
maybe we can ask, what's the breakdown? I mean, the 104 people they served. Ours was 14? I don't know.
How did it go from there?
It said 14 Tilton, 56 Franklin. I don't know why I wrote that one. Oh yeah, she's got it right down here. So out of the 100 and whatever people, 14 were Tilton.
Yeah.
Okay, how about the DNA stats? What do they mean? I don't get it.
Oh, I have notes,
I
yeah.
don't know what all the, top,
So we need it from
letters
them.
mean.
Aren't those the types of, so an LNA is a type of nurse, RN is a type of nurse,
I have no
physical
idea.
therapist, occupational therapist, homemaker, and what is an MSW?
Masters of social
Not
work.
master of social work.
Social worker.
So,
So we asked
the
percentage.
master of
is
social
what
work
we-
had 41 hospice visits in Andover. The LNA, that nurse, and there's also an RN.
And she broke it by town.
Yeah, we asked her to break it down by town.
216 is
yeah.
us. Oof.
It's just a little bit confusing, because we don't really know what each of those people do.
Yeah, we just go to the totals. What can we do?
Total visits, okay, and by, you're saying they're all basically equal to the same.
And Franklin is their biggest. That's it, 913 visits.
Yeah.
So we had,
Then it's Northfield and us.
what's the?
Oh, we're exactly the same as Northfield. 216.
We have 603 total visits.
Oh, for RN. Just
RN.
under that
Oh,
one.
oh,
Yeah.
There's different lines.
Yeah, you'd have to add, they
So
didn't
we have
add
to
them
add
up
all
for us,
those
you'd
up.
have to add up all the total visits.
and then there's a community health over on this side, which is not developing.
It's just glancing, we look second and then Northfield, so. Oh, they got a financial.
The difficulty I find with these types of statistics is, so they may have a home with one person in it that they're surveying, and they may visit that home,
Sure.
oh,
Okay.
you know, 20 or 30 times, depending on
Right,
the need.
right.
So
That's
it's
what I
hard to
mean, that
determine
this is
how many
not-
households did they serve.
They don't break their bank accounts and assets down. They got 3 million in bank accounts. What do they need us for?
I mean, we have 600 RN visits.
Right, but how many households does that represent?
And Northfield had 250.
Right, they could have went to the same one, like Catherine's saying,
Yeah, how many, like,
many times.
Franklin,
how many of these are individual versus, you know, they all should.
Yeah.
Yeah, Franklin had 2,700. But they are about 3 times as big as us.
So do we still want them to, oh no, that was the other one.
I'm not sure,
100 and
yeah.
something, never mind.
This is-
Come on,
I guess this is what we asked for, right?
Yeah.
yeah.
There's no way to put a value to those visits.
Did they give us?
No, but I guess if you added up the totals and then compared them to what those communities pay, and
In total, it's 13, so.
Well, Tilton was 1,772 from when they gave us the first initial report of visits.
did we
So you don't
expand?
have to add those up.
But you don't know
Well,
what
it'd be
each
interesting to
visit
see if it
entails.
jives with
Or how
those.
many households. I like the you know,
Yeah.
Nice.
household,
Visits, yeah.
because it said 82 Tilton residents,
There you go.
and they expect 86 next year.
So, so that means, looks like 30 visits per person? per, or 20
Well, you're at 1772.
Well, it's like a homemaker.
times,
They
divided
could
by
go
80.
into,
That's like 20 visits per person.
Right, but
Yeah, but like a homemaker.
5 different
they-
ones could be the same
Yeah.
household as well.
Right.
yeah, a homemaker could be going into the same house twice a week for months.
Mhm.
Yeah, and you could have somebody who needed an occupational therapist and a,
That's right.
you know, like when I've had their services, I've needed wound care, occupational therapy, and physical therapy. So I would have taken 3 different people,
Mhm.
So we have 82 in
and it was
Tilton.
like every other day for the wound care.
Yeah, yeah.
But
Do
the
we
other,
want the other town's number of people?
the other question to ask is, how much of this is paid by insurance?
Yeah, because we have 82 people.
Yeah, yeah, that's a good question. How much is insurance borne?
What?
How
So,
much does insurance pay?
with all of these that provide these types of medical services, like occupational therapists and home health
Oh, right.
homemakers, how much does the insurance pick up? How much isn't covered by insurance? How much do they get, you know, they have to?
Well, again, I think that would vary. In the beginning, the insurance might, all of them might be picked up by insurance. And then as the patient needs longer care, then the insurance won't pick it up. I mean,
My father had them, and they're marvelous.
Yeah,
My father had them, but there was no, everything was covered by insurance.
Ask
Them for a long
them,
time.
ask them.
We used to love homemakers. You know, he'd sit there and visit with them,
Yeah, right.
talk history.
That is an important part of it. Yeah.
But, so it, you
I
know,
don't really
it's-
have an issue with it, it's just trying to figure out how to quantify the values.
There you go.
It
Yeah,
doesn't help, but we know if we get good value from them, because everyone thinks that's so.
and then the other end is,
These
you
are
know,
tight
should,
times.
they are
from
wonderful.
all the towns they serve, it should be proportional to all of them. We shouldn't be paying more than,
Right. But that's what it's hard to quantify, because we don't really know what the values are.
They didn't give us who, the other towns, what they
Right.
pay. Did I see? Did
Who?
they? Yeah. Per town, what do they get contributed from those towns? We have the numbers now, where's,
Yeah,
how much
that's right.
does
That-
these
we kinda
towns
asked
give?
that too, right, right. Marina, want to send them another email?
That would be her.
Marina, yeah.
Yeah, Marina.
You want what now for which one?
DNA.
What do they get from the other towns and how many people do they service in those towns? How much?
Not how many visits, 12,500, same as last
You
year.
want more than
Well,
this?
what, when they sent us,
Yeah,
they
this is
said
just
they,
visits.
they serviced 84 people in this town, but there's 1,800 visits
no, they just,
spread
Just
across.
need
We don't
to
want
tell-
to know the visits, we just want to know how many people they served and what each town
Contributes.
contributes to their budget.
Like they're asking us for 12,500.
Same as last year, right?
Yeah.
I'm still confused. what
We're
you
just
want.
curious, you know how,
So you want something broken down more than this?
you know how
This is just
cap,
visits, that doesn't,
how many households in Tilton does this represent? They made all of these
She said,
visits with all of these
Christine said like
personnel.
80,
Houses.
82.
Do we want to know how many households? We want to know how many?
Christine said the 82, yeah.
it's
So
on the application.
yeah, on the application, it tells how
82
many.
number of residents.
Right, how many
So
residents.
it's at 82
So we
households.
want to know how many residents in these other towns and
What the town.
what is their.
And how much do they contribute?
Yes. That's it. They did a lot of detail that they didn't have to.
Yeah, I know, well, they probably have that in the computer, so they can
Yeah.
just pop it out.
Yeah.
Do you get that, Maureen?
You got my number.
I'm trying to see how to approach them.
it's just how many residents in each town they service and what each town gives them in return. How much they, you know, how much they request from each
For
town.
other towns?
Yeah, Same thing we asked from TAP, you know, we asked,
Okay.
how do you value and
So you
what do
wanna
you
know
think?
how much money they get from other towns.
And how many
How many
residents,
residents
and what do they
served?
request for those residents? Is it
Oh,
per
boy.
diem type of thing? I don't know.
Just how many residents they serve in each town and
How much they,
How much that
How
town
much the towns give
contributes.
them,
That's just two things, Marina.
she's getting,
yeah.
that's it.
No, it just sounds like it's getting more and more and more.
No, it's, we wanna know
Detailed.
how many people they
Okay.
serve in the different towns that they do serve,
We're gonna have to play with this.
and how much do they get
From the town.
from those towns.
I mean, they gave us a beautiful spreadsheet, but
Yes.
that's not what we want.
I mean, I can personally provide some of this, but I'll go to Jenny and Tabitha for the other.
Okay. If they can just email that, then you can
Yes.
get it done. All right, do we have anything else?
So no meeting next week,
No meeting next
but
week?
then meeting the following week?
Yes.
December 4th, hopefully, we should have the American Red Cross in some way, shape, or form.
Yes.
The 11th, we have the parks at 7:15. And I'm open on the 18th, so that's as far as I've got.
When is the, one about the police and the highway?
This is as far as I've got.
Okay, all right.
So
I'd
we can probably
Sure,
vote
yeah.
next week.
I'd like to make a motion that everyone have a happy Thanksgiving.
Oh, you too.
All in favor?
Aye.
I'd like to make a motion that we adjourn.
Second?
All in favor? Opposed?
I'm looking forward to it.
Marina, the text messages to remind me is excellent for
You
me.
like that? Email, texting, calling.
The text is the best. 'Cause
Okay.
the email, I
Oh, I
didn't
know
notice, I didn't notice the 4 o'clock email
See you soon.
with Tim when the note was on the door.
Kathy.
I don't have my emails come to my phone, I have it's too confidential, so.
I didn't get an email about the Parks meeting.
I know, right?
That's usually, Bob usually always sends me one to remind me.
That old,
I think he's just been.
I got the stuffed animals in the, over there.
You got him already?
Yeah, I picked them up today.
What?
Yeah, I added them right on and threw them in the, they're in the.
Oh my goodness.
Some of the boxes are a little wet today. They should be fine.
What's that? No, actually, I don't. Those were extras that I had printed before, thank goodness.
Yeah, good night, everybody.
You too, Bill.